Settings of mechanical ventilation. Mechanical ventilator settings regulate rate, VT, O2 concentration, and other characteristics of ventilation. Settings are based on the patient's status, example, ABGS, ideal body weight, current physiological state, level of consciousness, respiratory muscle strength. Settings for evaluated and adjusted until oxygenation and ventilation targets have been reached. It is important to check that all ventilator alarms are always on. Alarms alert the staff to potentially dangerous situations such as mechanical when malfunction, apnea, and unplanned extubation, or patient asynchrony with the ventilator. On many ventilators, the alarm can be temporarily suspended or silenced for up to 2 minutes for suctioning or testing while a staff member is in room. After that time, the alarm system automatically turns back on. The settings of mechanical ventilation are respiratory rate, F number of breaths the ventilator delivers per minute, usual setting, 6 to 20 breaths/minute tidal volume, VT volume of gas delivered to patient during each ventilator breath. Usual volume 6 to 10 ml/kg O2 concentration, FiO2 fraction of inspired O2, FiO2, delivered to patient. May be set between 21%, essentially room air, and 100%. Usually adjusted to maintain PaO2 level 60 mmHg or SpO2 level 90% positive and expiratory pressure, PEEP positive pressure applied at the end of the expiration of ventilator breaths. Usual setting 5 cm H2O pressure support, positive pressure used to augment patient's inspiratory pressure. Usual setting 6 to 18 cm H2O E ratio, duration of inspiration, I, to duration of expiration, E. Usual setting, 1:2 to 1 to 1.5 unless IRV is desired. Inspiratory flow rate and time, speed with which the VT is delivered. Usual setting, 40-80 L/min and time is 0.8, 1.0 second. Sensitivity determines the amount of effort the patient must generate to initiate a ventilator breath. It may be set for pressure triggering or flow triggering. Usual setting, a pressure trigger is set 0.5, 1.5 cm H2O below baseline pressure and a flow trigger is set 1 to 3/L minute below baseline flow. High pressure limit regulates the maximum pressure the ventilator can generate to deliver the VT. When the pressure limit is reached, the ventilator terminates the breath and spills the undelivered volume into the atmosphere. Usual setting, 10 to 20 cm H2O above peak inspiratory pressure.